Today I'm going to show you a tip and overview from my way to correctly place mid-face cheek volume for masculine look with dermal fillers. This technique differs from feminine treatments in that a masculine result aims for a neutral, flatter position to restore the natural volume loss without creating a prominent apple of the cheeks or define the cheekbones. For example, celebrities like Simon Cowell may have had too much filler, resulting in a prominent apple of the cheek, which doesn't look masculine. Hi everyone, I'm Nita McAvoy, an aesthetic practitioner and a teacher of injection mastery based in London, UK. Firstly, finding the apex or the maximum light reflection is crucial. Draw a line from the lateral canthus of the eye down to the bony prominence where the angle changes. This is your apex. Remember, we want to stay in the safe zone and not inject beyond the mid-pupillary line, so that we just stay away from the main facial arteries, so we just mark out that zone. I also like to use an ultrasonic vein finder to check that I'm well away from essential vascular structure. I also aspirate for 30 seconds at each injection point. You'll be surprised at how many flashbacks or positive aspirations happen at the 20th second. So I take my time and I work really slowly. Subtly volumize at the apex, ensuring that you're not over volumizing. So start with 0.1 to 0.2 mil, and you can always add later if needs be. The goal for a masculine treatment is a flat cheek with minimal projection. So you're only going to go up to maximum 3 millimeters, which is not a lot, so just be really mindful. We must also restore just enough to make it look like no filler or artificial contours are created. Remember, we are restoring volume for anti-aging, not creating an apple or a cheekbone structure for a masculine result. So then we look at the medial fat pad, which in most people is where they lose volume, giving the under eye lack of support and creating a hollow and loose sagging skin, making the mid-face volume restoration with filler a powerful treatment. We place the filler deep and we want to work just to here for the male mid-face restoration. We avoid the superficial fat pad, which are mobile and tend to drop over time, so the filler will also drop. When we're using a needle, we place it on the bone. This way the filler is deep and it avoids essential anatomy, and it sits under the fat and under the muscles to give a smooth overall result. If you're using a cannula, then feel the second pop, indicating you are in the deep subcutaneous layer. If you think the deep cannula will make the client feel uncomfortable, then numb the area before you start. I use a sub-Q density filler for this work, and I always work on the side of caution, starting with 1 mil for the whole treatment with 0.5 to each side of the face. You can always build on this in future treatments, but generally, if the filler placement is really good, you don't need a lot of filler. So tapering depends on the natural anatomy of the face. For example, if the zygomatic bone has an upward trajectory, follow that. If it is straight, taper it straight back to avoid creating anything abnormal. Now, this is not a full tutorial on masculine cheek fillers. It's a tip for masculine placement. I see so many practitioners getting it wrong and just following the bog standard one fit for all, which is usually for a feminine outcome. I'm not including essential anatomy and going further into science, as this is fully covered in all my courses. Remember, moderation and a flat cheek are critical for a masculine cheek filler result. For detailed training on treating clients, check out my courses in my Advanced Beauty and Aesthetics School. I hope you enjoyed this video and found it informative. Follow me for part 2. Until the next time, take care of yourself.